Will AI transform healthcare? Yes. If we don't do anything, our health systems are going to collapse. You have a risk of becoming very efficient at being inefficient.
This is a live edition of The Big Question. I would like to welcome our guest, the CEO of HealthAI, Ricardo Baptista Leite. Ricardo, pleasure to meet you.
Likewise. Thank you.
Please take a seat. AI, of course, promises to transform healthcare. How we will actually see that transformation in Europe over the next few years. Are you able to share your insights with us on that to start with?
We at HealthAI, we are the global agency for responsible AI in health, a global nonprofit based out of Geneva working with governments to build ecosystems. Will AI transform healthcare? My answer to you is yes. The question is, will it do it for the better or for the worse? And what I mean by that is that if we just start to introduce artificial intelligence into our current models of care, into our current health systems here in Europe, we have a huge risk because our health systems are fully focused on reacting to when people get sick. They are disease reactive systems. And so we need to fix the system so that it focuses on prevention, on promotion of health, and on quality of life. If you retrofit AI into our current models of care, you have a risk of becoming very efficient at being inefficient. The opportunity is here to use this intelligence revolution to transform healthcare completely so we can lower the burden of disease, so that we can make sure that the citizens across Europe and the world can have better health outcomes in the future.
What are the biggest problems in healthcare that AI could realistically help solve at the moment?
AI is already here. It's already transforming. Even during COVID, the development of new vaccines, almost every company was using some forms of AI. We're seeing AI across, so research and development, diagnostics, imaging technology. Every field of imaging right now is using some form of AI. Treatments, robotics, and surgeries, when we think about virtual assistants, virtual scribes supporting doctors in clinical decision making, even when we talk about the non-clinical aspects of healthcare in terms of fraud detection, financial claims with insurances, all of these fields have the potential of improving in terms of outcomes, be it in terms of cost saving, but also in terms of efficiency, in terms of improving health outcomes.
Healthcare systems are under enormous financial pressure at the moment, of course. Can AI realistically reduce costs while also improving outcomes for patients?
If we don't do anything, our health systems are going to collapse. They are not sustainable. People are just getting sicker and sicker. We're seeing a population that is getting older and with multiple morbidity. And so if we do not change the system completely, we will not be able to have the resources to make sure everyone will have access to the health they need. Mind you, no minister of health, no prime minister or president in the world will ever say they're going to shut down the health system because it went bankrupt. What bankruptcy translates into healthcare is into longer waiting lists. People who do not have money in their pocket, who are in more vulnerable situations, are the ones that are going to be left behind. So if we are serious about making sure that universal health coverage is a reality, artificial intelligence can augment the capacity of clinicians, of healthcare professionals, of nurses, of the admin staff, so that we can maximize our current workforce, so that we can be much more impactful in improving people's lives.
If the potential health benefits are that significant, what sort of investment is needed to make it happen?
We are seeing a lot of companies right now with amazing innovations, but they're hitting a brick wall. The question is why? There's the issue of trust. And that's what at HealthAI, working with governments, we're trying to build the governance system so that we can put in the proper ecosystem in terms of regulatory maturity, so that governments and regulatory bodies are more capable to respond to the needs of AI, and so that citizens and healthcare professionals can trust the technology. But then there's the money issue. Billions are being invested in research and development. Who is going to pay? If we want to make sure that this technology reaches everyone and not just a privileged few, health systems and insurances will have to step up. But the problem is right now we don't have the health technology assessment models in place so that we can assess the technology. This is incredibly important. It's part of our work with governments, which is how do we separate on one hand the snake oil from what is actually working, because a lot of technology that is being promised out there is actually not that effective. So how do you separate those two? And out of those technologies that do work, how do you make sure that you're paying the fair price? So developing those models will be critical so we can go from the pilot stage we are in today so that we can scale technologies, and those technologies can help the systemic transformation.
Is it something governments can realistically fund, though, or do you think we need to lean more on the private sector for this investment?
If you look, the latest global AI patent report shows that 61% of all AI-related patents came from China, 21% came from the United States, 2% came from the EU, plus United Kingdom. That is a concerning figure. When we look at AI and health, when you look at the United States, it's primarily funded by the private sector, venture capital.
Yes.
When you look at China, the other big powerhouse, it's mainly state-driven. This is actually the biggest opportunity for Europe, which is to be right in the middle, to bring together the public and the private sector to work together. I think it's critical that the European institutions understand that they need to work closer with the private sector, that the regulators need to create a pathway of conversation with companies developing the innovations from the start, from the moment they start developing the technology all the way to access to market. If we can find that perfect balance between private and public sector, Europe can really take a step forward and potentially overcome the lagging that we are right now.
AI thrives on data, but health data is sensitive. How can we guarantee privacy and security while still, of course, allowing AI systems to learn from medical data?
I think here in Europe, we have a huge advantage in comparison to other jurisdictions because we have already a lot of frameworks and mature regulation when it comes to data privacy, when it comes to European health data space legislation, which can be actually incredibly impactful even in fostering innovation if it's well implemented and ensuring access to the data for developers. The question I would ask people to think about is when they travel around the world, they go with a credit card in their pockets, and they can withdraw cash in any ATM machine around the world. And our financial data is highly sensitive. The financial sector has been able to put in the incentives within their commercial model so that it has a global system. In many parts of Europe, if I go to a hospital or a clinic and I go to the clinic across the street, they can't access my health data. And so there is a fundamental problem that we need to solve, and that's where I think the European health data space legislation could be a huge opportunity, not just at the European level, but at the domestic level, where governments need to prioritize. If that data is a commodity and it's worth money, why can't we redistribute that money to the people who share their data and create a model through which we can incentivize, even through financial incentives, so that people can be part of this process and control how their data is being shared? There are huge opportunities to have data governance models that can accelerate innovation, but most importantly, improve health outcomes for all.
Ricardo, on that note, thank you very much for joining us on The Big Question. We are going to have to end it there, but it's been great to get your insights on this.